Good day, ladies and gentlemen. I'm Dr. Kingsley Abhulimen of the Department of Chemical Engineering, University of Lagos. I'm also a Director of Technology and Innovation at the University Technology System Limited. We're going to be discussing on a research work we conducted for modeling clinical guidelines and effects of BIODRUG targets for treatment of an Alzheimer's patient. The research was based on data we acquired for an Alzheimer's patient, Alzheimer's case study, and we're going to be presenting our findings in this work. I also manage the Energy and Environmental Research Center at the Department of Chemical Engineering at the University of Lagos, a joint venture between Synthesized International and the University of Lagos. I'm going to be making this presentation at this conference, the proceedings of the ASME 2020 International Mechanical Engineering Congress and Exposition. And I'm going to be talking on the paper and our findings in this paper that present physiological disease function models derived from clinical data obtained from the caretaker of an Alzheimer's neurodisease patient. Patient X, how we want to describe the person. At the time of the research study was 76 years old, a female diagnosed with severe Alzheimer's, neuro and vascular dementia disease impairment, admitted into the intensive care, and a condition the patient had for 10 years. Now, the patient's vascular neuropathological pressure and disease models describing patient X AD condition were developed and used to characterize specific disease functions derived from clinical data of temperature, insulin sugar levels, concentration, and pressure prognosis. Current medication administered to the patient target acetylcholine inhibitors and neurotransmitters, and AB clearance and tau protein and inflammation. However, clinical simulation diagnosis from our research show that neuron antibodies should targets from disease functions from lower concentration of acetylcholine could be responsible for the Alzheimer's patient neurodegenerative disease state. The proposed clinical paradigm prospects using enhanced microbiota acetylcholine antibodies augmentation included in nutritional supplements in the diet of the patient could boost alpha enzyme secretase to prevent formation of extracellular deposit and amyloid peptides known as senile plaques in the AD patients. It is therefore recommended that microbiota acetylcholine augmentation, that's enrichment in amploid precursor proteins, could hold some prospects for treatment of patient X, evidenced by the near-field model statistics, clinical statistics. So we're making an introduction of our findings that the lower concentrations of acetylcholine in AD patients results in progressive, this is just a preamble, results in progressive and significant loss of cognitive, that is the genome biomarkers, and the behavioral biomarkers. Current AD medications, memantine and acetylcholine inhibitors, alleviate some of these symptoms by enhancing cholinergic signaling, but none of these medications are curative. Since 2003, no new drugs have been approved for the treatment of AD patients. Current research studies and clinical trials target neuropathological of the AD, including acetylcholine inhibitors and neurotransmitters, which are still in early stage of clinical trials. Thus, antibodies that target AB clearance, protein of AD71 genome, and intra neuronal neurofibrillary tangles has been diagnosed in synthesized clinical treatment options for AD management. However, none of these options consider acetylcholine augmentation derived from microbiota enzyme secretase, amyloid precursor protein, deficiency biomarkers, nutritional supplements derived from saliva from compactable AD patient or from those of close relatives. Recent research, clinical studies, and findings show that managed levels of microbiota enzyme secretaries biomarker from gut to brain on the amyloid precursor protein in saliva of the AD and Neurodisease patient is an important biomarker for acetylcholine augmentation. These are the findings we have been able to present in this our research work, that it is only that the acetylcholine enrichment could hold the key for prospective treatment for AD patients. Our report shows that microbiota alpha enzyme secretases in gut saliva system targets AD hallmarks for acetylcholine enrichment and intraneural neurofibrillary tangles formation in AD brain. Could hold the key for preventive, predictive, personalized prognostic patient care to manage neurodegenerative disorders, type 2-3 diabetes, insulin resistance, high blood pressure, stroke paralysis, and vascular dementia. Formation of the beta amyloid peptide pathway is called, could be totally removed from the pathway once we're able to understand that acetylcholine enrichment could resolve some of these things. Let me explain all this thing I'm trying to describe. Once we eat food, there's an enzyme in our saliva that breaks down the food, and it goes into our body and is assimilated into our gut system. But for an AD patient, we have discovered that the enzymes are no longer in an enhanced form, in an optimal form. So the reduction in the alpha enzyme results in acetylcholine production being deficient. And once that is not available, the food is not broken down into the molecules that it should be broken down into, and they form plaques, and they go right into the brain and other part and cause dementia and other form of diseases. Thus, activity of alpha secretases is dominated somehow by the activity of beta and alpha secretases. The study from previous research disclosed that studies of enzyme cleavage of APP into two specific positions, amino acid position 713 and 672 respectively, that generate AB42 peptide. The aggregation into the brain over time leads to the formation of senile plaques, that is main neuropathological feature of AD. The researchers also claim that tau is responsible for neuronal tangles formation in AD brain. So we have discovered that these various hallmarks are being used to diagnose an AD patient, but we are coming up with some form of acetylcholine enrichment that could help the patient. A number of useful phytochemicals have been isolated from the seed, and most prominent of them is Garcinia bioflavonoids mixture called colaviron. It is well-defined structure, and an area of biological activities include antioxidant, anti-diabetic, anti-genotoxic, and protective properties. The chemopreventive properties of veronical amygdalina and Garcinia bioflavonoid has been attributed to their abilities to scavenge free radicals, induce detoxification, and inhibit stress responses proteins and interfere with DNA binding structure of some transcription factors. The medication of 4 and 6 units of insulin shot that were administered to the patient at those specific times to boost the immune level and to lower sugar levels that's above normal could suggest that the AD, that Alzheimer's disease, is also a type 2-3 diabetic, could also be used to ascertain type 2-3 diabetics. It's the same thing. Patient X was also administered dosage of enalapril-maleate, 5 mg, manufactured by Tara Pharma USA, which is a yellow round-shaped tablet imprinted with T5 on the front, administered daily to the patient to reduce blood pressure. So blood pressure is another symptom of the AD thing. So our clinical trial methodology, model development. Now, AD is diagnosed and confirmed by the presence of extracellular deposit of B-amyloid peptide known as senile plaques. According to the most prevailing hypothesis, AD occurs due to altered cleavage of amyloid precursor protein based in the cell membrane of the neurons hypothalamus by secretase enzymes. Under normal conditions, alpha secretase enzymes cleaves AAPP at the site amino acid position 770. I can't go all the way, but these are the drugs that have been produced till date and have been approved for Alzheimer's disease. We have donepezil, that's the drug name, and it's branded Aricept, and it's approved for all stages of Alzheimer's. It was FDA approved in 1996. Another one is galantamine, and its brand name is Razandine, mild to moderate, and was approved by the FDA in 2001. Memantine, its brand name is Namendane, moderate to severe cases. Then we have Rivastigmine, and we have donepezil and mentamine, both approved in 2000 and 2014. So these are all the drugs that have been approved so far. So efforts to find a cure for AD have met disappointment, and drugs currently available do not cure the patient. Most food and drug administration drugs provide some relief in symptoms with limited effectiveness. Some side effects of current drugs have also been reported. Till date, the U.S. Food and Drug Administration approved only 5 drugs for AD. The approved drugs temporarily improve detonating symptoms of Alzheimer's patients. So we're going to look at these findings. We collected a lot of data for this particular patient, and we looked at some very important biomarker. That's the blood temperature, blood pressure, and blood sugar. And we're able to come up with some very interesting results, which are presented here in my slides, and I think is made available to you on this. So we analyzed the blood pressure relationship, and we're able to come out with a model for presenting the disease factors. So once we're able to derive the model for the disease factors, we can use that model to predict what happens to the patient. And all these results have been presented in this work. So in conclusion, the preclinical simulation study of an Alzheimer's patient derives from clinical data from a close relative. We developed the physiological models, and our conclusion shows that with multiple potential treatments with their varying effects derived from Alzheimer's physiological arterial blood pressure and the patient vascular pathological pressure and disease condition, based on our models, we're able to derive that the use of nutritional supplements like what they call beta-cola, what they call garlic, and all these things could serve as pressure reducing agents for the Alzheimer's patient. The whole essence for this is to be able to we've also been able to culture some microbiota that could be used to enhance enzyme production that could assist acetylcholine enrichment. So thank you very much, and hope I can take any questions now for the purpose of this presentation.